If you could have our listeners remember just one thing when they're trying to decide whether they're going to take FMLA or not, what would you hope that people would keep in mind?
Caregiving is a part of life. So they should never feel guilty about the fact that they may need to take time out of the workforce to provide care for a loved one or take care of their own health need.
Welcome back to HealthQ, a special from KFF Health News and Nashville Public Radio. I'm Cara Anthony here with Blake Farmer.
I'm right here.
Today, we're talking about the sandwich generation. And for many of us in this stage of life, that means we're balancing our jobs and caregiving for both our kids and parents.
Yes, although, as we've heard, some of us are doing a lot more balancing than others, Cara. But yes, we're in this generation together.
Well, sometimes it's just too much. Jill Woodrow, who lives in Rahway, New Jersey, faced the situation a few years ago. Her mom was a cancer survivor, and she had several new symptoms that were concerning. She was also starting to have a hard time driving, and she couldn't remember what her doctors were saying at the appointments. So Jill decided to step in and take her mom to the doctor.
I was working full time. I had 3 children and then also taking care of my mom. And, I was having to leave work early or take sick time, personal time. And all of a sudden, my best friend said to me, Jill, have you ever thought about taking FMLA? And honestly, I never did.
FMLA is the Family and Medical Leave Act. This is the federal law that provides 12 weeks of unpaid leave for medical issues, parental leave, or for caregiving for a close family member who's in a serious health condition.
Jill decided to take FMLA to help with her mom's care. She said the hardest part was dealing with her own feelings about taking time off.
I did feel very guilty. I'm a school social worker. I have a lot of students on my caseload, and I felt so guilty about leaving them.
But she worked with her employer to plan and train a temp worker to take over for her. She took 8 weeks to take care of her mom. On the other side, no regrets.
It really just opened up my days where I didn't have to worry about asking my boss, can I leave early? And it was nice too, because then my mom was able to come to our house. I was able to cook for her, help her out with food shopping. It wasn't just doctor appointments. It was doing household things as well.
So joining us now to talk more about FMLA and how to navigate this decision is Jocelyn Frye, president of the National Partnership for Women and Families, the organization which helped get the original FMLA legislation passed in 1993. Welcome, Jocelyn.
Well, thank you for having me. It's great to be here.
Yeah, Jocelyn, I kind of want to start with a spicy question. FMLA provides up to 12 weeks a year of unpaid leave for caregiving, unpaid. But taking time off without pay doesn't sound that great. I mean, should we really be calling this a benefit?
It's a great question, Blake. I think it is a benefit, but it has its limitations. And one of them is that it's unpaid leave. When the FMLA was passed in 1993, it was groundbreaking. It had never been done before, and it was a shift for folks to think about accommodating work-family needs as a workplace policy. So it was a groundbreaking shift, but a lot of folks can't take unpaid leave. If you look at the data, I think just under half of people say they don't take paid leave because they can't afford to be out of work.
Yeah, I don't know if I could be out of work for 12 weeks and it'd be a real challenge.
Yeah,
It is true.
Jocelyn, let's very quickly break down some of the logistics of FMLA. Are you ready for some rapid fire questions?
Absolutely.
All right. Who is eligible to take FMLA?
Well, you have to be a worker with an employer that has 50 or more employees, and that worker has to work at least 1,250 hours a year for at least 12 months prior to taking the leave, and you have to have worked for the employer for 12 months. So about almost 45% of workers are not eligible for FMLA because they don't meet one of those requirements.
Okay, this is good to know. Let's jump right into the next one. When can you take FMLA for caregiving as opposed to just taking sick time?
The definition is basically, and Blake said it at the beginning, it's a serious health condition. So serious is open to interpretation. It tends to be a condition that require an overnight stay in the hospital. It's something that is either a chronic condition that's going to be occurring for a long time, or a condition that's going to keep you out of work for, 3 or more days. Paid sick days tend to be for illnesses that are much shorter duration.
It still seems like it would be a challenge to determine what qualifies for FMLA, but
I mean, sometimes you can have a doctor's note that can also confirm this is a serious condition that is going to require, 2 weeks of recuperation, that type of thing.
This is great information. And last rapid fire question here. Is it possible to get paid for FMLA?
Yes, although the FMLA doesn't require it. There's sort of two ways that people tend to get paid while taking paid family and medical leave under the FMLA. One is that they're in one of the 15 states now, including DC, that has paid family and medical leave as a requirement across the state. In those states, employers are required to provide paid leave. Obviously, if you haven't hit the lottery and you're not in that state. The other way that you can typically do it is if you have paid vacation or other forms of paid leave, you can tell your employer, well, I want to use my week of vacation or 2 weeks of vacation as part of my FMLA leave. So it will run concurrently, but that way you're getting paid for a portion of it. That tends to be the way that people do it.
sounds like one way or the other, you're having a long conversation with human resources about this before you take FMLA. If you're just joining us, you're listening to HealthQ from Nashville Public Radio and KFF Health News. We're talking to Jocelyn Frye from the National Partnership for Women and Families.
Jocelyn, some people are all in for taking extended time off. But for some of us, we might avoid taking leave because we have all sorts of anxieties. We're talking about navigating office politics, wanting to be seen as a team player, not wanting to put too much extra work on our coworkers.
Yeah, and even though it's protected, I think some of us are thinking about the long term. Like, would this put our job at risk down the road when we get back?
Yes, personally, I've thought about this a lot, and I know I might face this decision down the road. So help us. If we're feeling unsure about FMLA, whether to take it or not, how do we decide?
The way I would start is first and foremost just thinking about what your need is. If your mom is sick or your dad is sick or your spouse, then they have to be your priority. And I would always encourage people just to first start with what is it that you need and think it through and have a plan. The second thing I would say is that with your employer, even if you're not planning to take leave now, but you're sort of planning for the future, to really talk to them about how do you actually do education across the organization. This is a benefit, it's available to all, and you have to create a culture in the organization that allows people to take it. And if people think that they're going to lose a promotion or something like that, it's not supposed to happen. It's prohibited by, law. You're not supposed to be penalized for it. And you have to create a culture that says everybody is welcome to take leave. What we know from the data, I will say, is that there are lots of people who express the very concerns you raise. I think it's a little over 40% of workers say they don't take it because they're worried that it will affect their job in some way. We know men often don't take it because they think men aren't supposed to take leave. It's really supposed to be women. So we try to encourage people to defy those stereotypes. And that's important for workers themselves, but it's also important for employers to create an environment where people do actually feel like they can take leave that they're entitled to take.
Well, Jocelyn, it's almost like you're reading my mind here about men. I'll just fess up. I mean, I think I would be hesitant to consider taking time away when it comes to FMLA. What would you say to men beyond, just defying the stereotypes?
What I'd say is that increasingly, if you look at the research, more and more men say, I want to be involved in my family. I want to support, my mom or my parent when they're sick. And I want to be something different than maybe what the stereotypes dictated men to be, decades ago. And I would say to any man, you are entitled to support and be involved in your family. The other thing I would say is that what we know from the research, again, in states that have paid leave, is that men are more likely to take it when you have a sort of a gender neutral benefit. That's one of the reasons that the FMLA was passed in the first place, is that without it, women were always the ones who were doing the caregiving, and they were more likely to be targeted in a negative way. When you have a benefit like the FMLA that is gender neutral, it's available to everybody, it helps to create the expectation that this is not about men versus women. This is about whoever needs to provide care and supporting them in that time of need.
By gender
Um,
neutral, are you saying that this isn't just maternity leave or something?
That's exactly right. It's paid family and medical leave. It's for a serious health condition, for your own health condition, or for that of a family member. So it gets us out of the box of only being for maternity or paternity purposes, and understands that, family caregiving is also important.
Okay, all of this is really helpful. I'm starting to feel smarter already. But really hold my hand, hold Blake's hand here. How do we start to have this conversation with our managers? Like, literally, Jocelyn, give us a script. If someone is making this decision, what do we say?
Well, I would start with saying everybody has a care need. Caregiving is, part of the lifeblood, not only of our communities and our families, also our workplaces. And so I'd say to any manager, let's start with a realistic expectation of the different things that are likely to affect workers in this workplace, and to make sure that we're creating a space so that they can be successful. We know from data that when people are able to take leave and manage their work family responsibilities, they tend to be more productive. There's better morale, and you can plan for absences. So I think it's a good strategy for actually making the workplace more productive and more efficient, and actually trying to bring issues that are, sometimes hidden from view, people don't want to talk to create sort of more transparency around how do we make sure that we're accommodating these needs in a way that actually work for our workplaces. And let's talk through how we can do that. The last thing I'd say is that to any manager, I'd say, I want to work with you to make this work for everybody, just as I would want to support you when you have a care need, because chances are that manager is going to have one in their lifetime.
Well, I understand that you kind of went through this a bit when you were working in the White House. I think your mom was very ill. How'd you
Yeah.
navigate that?
I did a little bit of what I just said. I was fortunate that I worked with people who I knew, as a practical matter, supported these types of policies. And I talked to my mom a lot about what she needed. My mom had cancer um, a few years after my dad had lost his life to cancer. And I needed to be there for her when she needed me. She wanted to be somewhat independent, but she wanted to stay at home. We had somebody as a caregiver during the day, and then I would come in the evening. And that's the way I knew she wanted to live her life and end her life. And that was my first priority. And, I think that the thing I would say about FMLA, not everybody has to, I didn't take FMLA, but I had sufficient flexibility that if I needed to leave early to take my mom somewhere, or if I needed in, the last couple of weeks of her life when I needed more extended time just to be there with her, I could do that. And I think that's the type of flexibility that people are often looking for. When my dad needed me to drive him to chemo, I just, needed to be able to come in a little bit later so I could take him in the morning, and then I would stay later at work. In many ways, this is about what are the reasonable types of arrangements that we can make with our employers to accommodate needs that many of us are going to have in our lifetimes, without sort of impeding our work in a way that makes sense.
Yeah, and I mean, I could imagine that Gosh, if your mom and dad could see you now, they would be so proud. And you've been on the ground floor of this topic for a long time. And let's just acknowledge that there haven't been any major changes to FMLA legislation since it passed in 1993. So, Jocelyn, if you could wave a magic wand and change it, what would you like to see?
I would do a couple of things. One is, I mentioned the fact that the employers who are covered have 50 or more employees. So there are lots of small employers who are not covered by the FMLA. That leaves out a good percentage of workers. So I'd probably reduce the employer-employee sort of threshold. Truthfully, I'd make it paid. I'd figure out a way to get pay through the FMLA. If not, I certainly would make clear that there was a fairly narrow family definition. And what you see in many of the paid leave laws in states is that they broadened that to cover, more than your parents and your spouse and your kids. The last thing is, we're fighting for paid family and medical leave at the national level. Our view is that every worker should have access to leave and they should not fear losing their job and their livelihood when they need care or their family needs care.
So we're wrapping up here. If you could have our listeners remember just one thing when they're trying to decide whether or not they're going to take FMLA or not, what would you hope that people would keep in mind?
Caregiving is a part of life. So they should never feel guilty about the fact that they may need to take time out of the workforce to provide care for a loved one or take care of their own health need. We are in a society that often pushes people to work 24/7. And I certainly understand that's critical and important, for people's economic stability. And I wouldn't take people away from that. But caregiving is essential to how our country functions, our economy functions. When people need to provide care, they need to be able to do so without sort of being on the defensive 24/7. And I'd say to people, be thoughtful about choices, speak with your family member, see what they need, and try to be responsive to them. And then be unafraid to say to people, this is what I need to be productive at work and also responsible to my family and to know their rights. And hopefully that conversation can be a positive one.
Jocelyn Frye, thank you so much for being here. Jocelyn is president of the National Partnership for Women and Families.
Thank you for having me. It was great.
When we come back, we're jumping into the other side of the sandwich when kids need a little more help than we can give them. We'll be right back with more HealthQ.